Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about non-malignant disorders of neutrophils. Neutrophilia refers to an increase in the total circulating absolute neutrophil concentration. Benign neutrophilia occurs most often as a result of a reaction to a physiologic or pathologic process and is called reactive neutrophilia. Reactive neutrophilia can be immediate, acute, or chronic. Immediate neutrophilia can occur without pathologic stimulus and is probably a simple redistribution of the marginated granulocyte pool to the circulating granulocyte pool. Neutrophilia is immediate but transient. This redistribution of cells accompanies strenuous exercise, epinephrine administration, anesthesia, emotional stress, shock, burns, trauma, convulsion, and anxiety states. Acute neutrophilia occurs within 4 to 5 hours of a pathologic stimulus. This type of neutrophilia results from an increase in the flow of neutrophils from the bone marrow storage pool to the blood. The proportion of immature neutrophils may increase. Chronic neutrophilia follows acute neutrophilia. The bone marrow shows increased numbers of early neutrophil precursors. The immature cells in the peripheral blood are usually bands, metamyelocytes, myelocytes, and promyelocytes. An increase in the concentration of immature forms of leukocytes in the circulation is termed a shift to the left. Toxic changes including toxic granulation, dull bodies, and cytoplasmic vacuoles are often found. Neutrophilia and shift to the left, in a patient with chronic neutrophilia. Shift to the left and toxic granulation in a patient with chronic neutrophilia. The term leukemoid reaction refers to a reactive leukocytosis with neutrophilia and a marked shift to the left. In a neutrophilic leukemoid reaction, the blood contains many bands and metamyelocytes, increased myelocytes, promyelocytes, and rarely blasts. Leukemoid reactions are mostly a result of acute and chronic infection, metabolic disease, inflammation, or response to a malignancy. Leukocytosis, neutrophilia, and shift to the left in a patient with leukemoid reaction. Composite image of peripheral blood smear from a patient with leukemoid reaction showing shift to the left. A neutrophilic leukemoid reaction may produce a blood picture indistinguishable from that of chronic myelogenous leukemia. Several distinguishing features between neutrophilic leukemoid reaction and CML are listed in the table. Leukoerythroblastic reaction is characterized by the presence of nucleated erythrocytes and a neutrophilic shift to the left in the peripheral blood. Often, erythrocytes in this condition exhibit poikilocytosis with teardrop shapes and anisocytosis. The total neutrophil count may be increased, decreased, or normal. Leukoerythroblastosis is most often associated with chronic neoplastic myeloproliferative conditions and severe hemolytic anemias such as Rh hemolytic disease of the fetus and newborn. Nucleated erythrocytes shift to the left and teardrop cells in a patient with leukoerythroblastic reaction. Pelger-Huët anomaly, also known as true or congenital PHA, is an autosomal dominant disorder characterized by decreased nuclear segmentation and a characteristic coarse chromatin clumping pattern potentially affecting all leukocytes, although morphologic changes are most obvious in mature neutrophils. Neutrophils in Pelger-Huët anomaly appear to function normally. The significance of recognizing Pelger-Huët anomaly lies in differentiating the benign hereditary defect from a shift to the left occurring with infections. In Pelger-Huët anomaly, the bilobe nucleus has a characteristic dumbbell shape with the two lobes connected by a thin strand of chromatin. Cells with this appearance are often called eyeglass-shaped or pince-nez cells. Composite image of peripheral blood smear from a patient with Pelger-Huët anomaly showing hyposegmented neutrophils. Acquired, or pseudo-Pelger-Huët anomaly, can be seen in myeloproliferative disorders, myelodysplastic syndromes, acute myeloid leukemia, chronic myeloproliferative neoplasms, HIV infection, tuberculosis, mycoplasma pneumonia, and severe bacterial infections. Some drugs and chemotherapies can also induce pseudo-Pelger-Huët anomaly. The acquired Pelger-Huët morphology is frequently accompanied by hypogranulation. Alder-Reilly anomaly is an inherited condition characterized by granulocytes with large, darkly staining metachromatic granules, composed primarily of partially digested nucleosaccharides. The granules are referred to as Alder-Reilly bodies. Alder-Reilly bodies are most commonly associated with Hurler syndrome, Hunter syndrome, and Maroteaux-Lamy polydystrophic dwarfism. Leukocyte function is not affected in Alder-Reilly anomaly. The Alder-Reilly morphology may resemble heavy toxic granulation. Neutrophilia, dull bodies, and left shift, which are usually associated with toxic granulation, are not seen in Alder-Reilly anomaly. Also, in some patients with Alder-Reilly anomaly, the granules are found in lymphocytes and monocytes, ruling out toxic granulation, which is exclusive for neutrophils. Chidiac-Higoshi syndrome is a rare, fatal, autosomal recessive disease, characterized by abnormal fusion of granules in most cells that contain granules throughout the body. Hematologic findings in Chidiac-Higoshi syndrome include giant lysosomal granules in granulocytes, monocytes, and lymphocytes. Bleeding issues due to abnormal dense granules in platelets. Neutropenia and thrombocytopenia as the disease progresses. Meheglin anomaly is a rare autosomal dominant platelet disorder characterized by variable thrombocytopenia, giant platelets, and large dull-bodied-like inclusions in neutrophils, eosinophils, basophils, and monocytes. Clinically, the majority of individuals with Meheglin anomaly are asymptomatic, but a few have mild bleeding tendencies that are related to the degree of thrombocytopenia. The image shows dull-bodied-like inclusion in a neutrophil. Composite image of peripheral blood smear from a patient with Meheglin anomaly, showing dull body-like inclusions in neutrophils. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.